Hello, this is Jesse from DeathRattleSports.com here to talk about a couple stories we featured on Death Rattle Sports. The first has to do, it's kind of an older story, but I couldn't believe the article when I read it. It's about Walmart expanding its services to include all sorts of healthcare. And the author, who is Sally Pipes, and she's the president of the Pacific Research Institute, she says it's an awesome thing because she says that's great news for American consumers. Retail health clinics like those operated by Walmart and its peers represent crucial components of our nation's drive to expand access to affordable health care. So I think we can all assume that Obamacare will arrive in Walmart soon. And, you know, my whole thing is I would like to go, you know, for my health care to a place that I know has my best interest in mind as far as health goes. And Walmart, I mean, their prices are great, and I can buy a tent there and go camping for very cheap. But when it comes to food, it's almost all crap there. Very little in the way of organic, and what is organic there, you got to question, you know, is it just something where they started being organic recently for marketing purposes, and before, they've got 30 years of pesticides laying there already? You know, I don't trust it anyways. So you have Walmart Healthcare, and so, you know, my whole thing is, you know, prevention is the best medicine. So everything about Walmart is opposite of prevention. You know, I can remember when, for example, I was diagnosed with ADD, and, you know, I told my doctor that I kind of just slipped through high school, really didn't learn anything, and he heard a few things and he decided that I might have ADD. He put me through some tests, and I did in fact have attention deficit disorder. I mean, the thing is, I had poor eyesight, and I never wore glasses until I got to high school. So I literally like sat 3 feet from the television all growing up, and I watched TV all the time. Started out, I would watch Teenage Mutant Ninja Turtles. Then I got to a certain age, and I'd watch Sports Center every morning. Then I would go to school. We would watch Channel 1, which I think most kids in America watch Channel 1. You know, during school, I remember during study halls and stuff, I'd watch the Jerry Springer Show and whatever else we could watch during study halls when the teachers weren't around. And so that's basically, and, you know, I think a contributing factor. And then all the video games and everything else. I mean, it's just preposterous to think that I sat 3 feet away from the TV. So I think if anything contributed to my ADD, that might have been it. Also, the fact that at lunch I ate crap. You know, whether it was the school lunch, or, you know, honestly, I would like trade a lot of the food because it was so bad, and I would just get like candy and snacks, and, you know, I did everything possible to kill my attention span. And so that was the contributing factor to my ADD. And then once I was diagnosed, I ended up being prescribed to Adderall. I started out with something different. I can't remember the name of it, but it was horrible. So then they moved me to Adderall, and that actually helped me focus for sure. I mean, that helped me plug away through college, but it also left this terrible taste in my mouth, and I'd lose my appetite, and I would get a little bit crazy. I mean, I remember at the time I'd always argue with my ex-girlfriend about things, and I would just obsess over the dumbest stuff, and it just wasn't good for me mentally at all, even with my increased focus. So I remember I went to this family doctor I had been seeing in Florida, a different one at this time, and I was telling him about this, and he was like, "Stop taking Adderall. You're done. Don't take Adderall. Just drink coffee if you need to focus." And after that, I decided he was right, and probably should have made that decision on my own. But he gave me a sound piece of advice. Now, would a doctor at Walmart give that same advice? I don't know. You know, I'm sure it varies from physician to physician, but I don't trust Walmart. You know, and the whole idea of going to Walmart for your medical care is just, it's very odd. You've got to think that I mean, like I wrote in the article, what's next? You go there, you can have a baby there. You get a discount from having your kid there. If you have a coupon from Groupon or something, you just scan it on your smartphone. And then you die, and they can clean up your body and turn you into fertilizer and sell you to all the consumers looking for great deals on fertilizer at discount prices, always low prices. So then you've got all of that going on. And you have an article from vactruth.com about Big Pharma, Big Bribes. And it says the U.S. Department of Justice reported Pfizer using its influential money to bribe foreign governments and their health officials. The apparent goal was to use Pfizer's money to create unfair economic advantages in the market to peddle their pharmaceuticals and vaccines. This is no surprise. It's almost not even newsworthy. I think we just assume this happens. So the thing about being a doctor is you are basically the most trusted person locally in your community. If you're a doctor, people trust you more than anybody else. And they trust the fact that you're not going to be bought and sold. I think as you decentralize, it's more and more is going to be true in those respects. But as they start to group together and all work at Walmart, it's hard to say that you can really trust those doctors nearly as much. And the other thing is, the other thing is, we've been talking about school loans a lot on Death Rattle Sports, and these doctors are graduating with these huge debts, and it's just hard to pay off. It's hard to make money for doctors, a lot harder now than it used to be to make money. So they have these huge debts. It's hard to make money, and then they have these drug companies coming in and bribing them, and it's hard to blame the doctors for being influenced by that. They have bills to pay like everybody else. And even though their career comes with a little bit more of a moral attribute to it, you cannot discount the fact that they're human. They need money. They need to feed their family. They work their butts off to go to college and become doctors. They probably feel like they deserve a little bit more money than everybody else. And if they're not getting it and they're facing a ton of debt, well, you kind of almost expect them to take these bribes. So this is the system. You graduate with a ton of debt. It leaves you vulnerable. Then you don't look out for the best interests of your patients, and it's pretty much, I think that's why they do it the way they do. They leave people in a position where they can be bribed. We had Terry as a guest, one of our bloggers. I was talking to him the other day, and he's going to be a lawyer. He's expecting to graduate with $150,000 in debt. He says that when he graduates, if he can't find a job to pay off that debt, that he'll probably end up working for the government, first with the military, then he can go be a college professor. Once again, you're trapped into this black hole of the public sector, and he would be great in the private sector because he's a smart kid, but now he's looking at $150,000 in debt, a starting salary for many lawyers around $50,000. So that's not going to be easy to pay off, and the military will pay that off for you if you just sign your life away. And again, that's why the system is set up the way it is. That's why the public sector can thrive the way it does. That's why they're able to suck away all the talented people to it. And I'm sure it's the same way with doctors and psychologists and psychiatrists and medical doctors and all the rest. So that is the situation we face in America, and that is why the quality of service is being sucked dry as central power reigns supreme. And it's these practices, this way of doing things is spreading globally. It's not just America, and they're starting to bribe countries all over the place, and some are standing up, some are not. Anyways, this is Jesse from DeathRattleSports.com. Thanks for your support. Like us on Facebook, subscribe to the page. I'm going to have all sorts of interviews lined up with professionals and bloggers and people that really know what they're talking about. And thanks for watching.